Joint pains in children. A pediatric rheumatologist is a specialist who offers with children affected by arthritis and other connective tissue diseases. Maximum of those illnesses are autoimmune in foundation, a situation wherein a pediatric rheumatologist is an expert who offers with youngsters stricken by arthritis and other connective tissue illnesses. Maximum of those sicknesses are autoimmune in origin, a condition where our immune machine attacks our tissues. Dad and mom of younger kids often fear about joint and limb pains in their children and are not positive whether clinical attention is wanted. A number of these youngsters may additionally have arthritis, and such parents are seeking an opinion from a pediatric rheumatologist. Right here are a few common questions asked to a pediatric rheumatologist. Will we need to take our toddler for a few exams once they whinge of joint and leg ache? Do we need to get an X-ray executed to become aware of the problem? My child reveals it tough to walk round and his gait appears specific. What have to I do? Does my child have arthritis? While ought to I be involved about my baby's joint ache problems as a figure? This newsletter could attempt to cope with those questions. This may minimize unwarranted tension in dad and mom to some extent, and additionally manual dad and mom as to when should they are trying to find early and powerful session with the pediatrician, rheumatologist for the pleasant joint ache remedy for kids in Bangalore. Developing pains. At some stage in the nighttime hours, while children are back from school, they regularly bitch of limb pains. At some stage in the day, they are otherwise active. These youngsters frequently come to be cranky at some point of the slumbering hours and hold to shift their legs restlessly. Whilst their legs are massaged, they experience comforted. After they wake up in the morning, they do not have any proceedings. No swelling is visible in any of the joints. These signs and symptoms point to what we consult with as developing pains. These are pains cited in developing youngsters, as the call shows. They're a part and parcel of the regular improvement of many kids. Some of those kids may also have a nutrition D deficiency which a pediatrician can effortlessly deal with. Whilst youngsters mature into their teens, those pains subside. For these youngsters, any blood take a look at or X-ray isn't always vital. Arthritis. It's miles essential to understand when it is urgent to reap advice approximately joint ache. If a toddler has the subsequent joint ache problems, they need to be treated as warning signs and symptoms, and urgent consultation and right assessment are required. Joint swelling. If the child reviews of pain and there's joint swelling, warm temperature throughout the joints. Morning stiffness. It is hard for a kid to transport in the early morning hours whilst she wakes up with joint pains or limps even as on foot, however gets better because the day passes. Fever with joint pain. Fever and joint pain can be caused by a viral contamination, dengue, chikungunya. However, it is able to sometime be because of a sinister underlying ailment, blood most cancers. Joint ache with pores and skin rashes, those desires urgent evaluation. This may be because of a easy viral fever or from time to time because of an underlying disorder affecting blood vessels, called vasculitis in clinical terms. Loss of weight or terrible urge for food. Kids can also develop rheumatoid arthritis, inflammatory arthritis, within the equal manner as adults, which may purpose permanent joint harm. We call it juvenile arthritis in children. Those youngsters whinge of joint pain and frequently have one or more joints that swell. Pain and stiffness in the morning hours are worse. They increase deformities if now not dealt with in time. It's miles crucial to word that dad and mom regularly are looking for an orthopedic opinion on such troubles, though there's no orthopedic problem. These children need to be nicely assessed through pediatricians and pediatric rheumatologists. Further, they should get blood checks and need long-term scientific attention. Few health pointers to hold your child's joints and muscles strong. Nutrients and minerals-rich meals. Diet must include fresh end result and vegetables. For people who devour a non-vegetarian food regimen, fish liver oil is a great source of nutrients required for bone health. Permit your child consume them every day. Drink lots of water. It is good to have 1 to 2 liters of water each day. It enables keep away from muscle aches. Further article search. This enables improper digestion and boundaries constipation. Consequently, water is vital for a healthful residing. 30-minute stroll, jog every day for at the very least 5 days per week. Growing wholesome conduct inside the day-by-day routines from youth will help hold your child healthy for years. Stem cell therapy will completely cure pains in any area or part of the body for both young and adults. You can contact me for stem cell product for personal use or as a distributor. Please subscribe and share our YouTube channel for more on health-related topics.